So we are in our COVID reusing of PPEs. Just a reminder that this is not a forever thing, it's a temporary thing. And we're gonna walk through how to put on and take off our PPE that we're gonna be reusing. A couple things, making sure that your hair is up and out of the way so you're not getting in contact with your gowns and it's not falling off to your side and you're wanting to touch your hair or your face. So we'll get started. We are going to be using lab coats. So this is me starting my shift. I have my lab coat here that I will be using for all of my patients with COVID that I will be taking care of. The first thing is going to be taking a label and putting my name on it so that I know it is mine. The other thing that I will be doing is having 3 bags, a bag for my N95, and they are a 5-time use when we are reusing them. So just putting lines there so you know how many times you've used it. And remember, that's for aerosol generating procedures only. And then I will also have a bag for my goggles and a bag for my regular face mask. So I'm going to just put on my lab coat like I normally would. I'm going to zip up my jacket. And if you want to button, you can, but you definitely don't have to. Just knowing that if you're putting your hands there, you're putting yourself more at risk of touching your skin. I'm also going to grab my mask. This is my first time mask for the day, but it's the mask I'm gonna use, so I will be reusing this. Putting the loops on. Then I'm also gonna take my reused goggles, putting those on. And gloves can be put on before the mask and the goggles. But this is our first time use for the day, starting our day, so nothing's contaminated yet. And now I am ready to go into the patient room to start my day. So I will go in and do my cares. And you'll do your usual patient cares, your assessment, your vitals. Once I am finished, I am going to grab some Sandy wipes. And I will use my Sandy wipe to touch my door handle and pull it shut to keep that clean. I will also take this Sandy wipe in a downward motion. You're going to wipe your lab coat just to kind of help get rid of some of those germs for while you're taking this off. Additionally, you're going to want to wipe the inside of your zipper. And then you can take this Sandy wipe, grab your zipper, and unzip. I'm going to get rid of my Sandy wipe and my gloves. I'm going to use hand hygiene. And now at this point, you're going to lean forward so you can reach the inside of your jacket, getting them off of your shoulders. And you're going to take a hooking method to get your sleeve, your hand out, trying to only touch the inside. And then you're going to let that fall off on the side. And same thing here, trying to only touch the inside of your jacket. And I will take my jacket and hang it on my hook. And then that will be for the next time I have to go into the patient room. So now to get my mask off, I want to make sure my hands are clean again. And then I'm going to open up my bags. For my mask and my goggles. And I'm going to put on some gloves. And grab my Sandy wipes. Taking my goggles off. And I'm going to start with cleaning the inside of my goggles and then the outside. And then once you are done wiping down your goggles, you're gonna throw that Sandy wipe and put your goggles in your goggle bag. Then you'll grab a new set of gloves, use some hand sanitizer, and then when we are reusing our regular masks, what you want to do is try to grab just the ear loops and get those so they'll be on the inside, touching just the upper corners of the mask, making sure the loops fold on the inside of itself, so that way it's not touching the dirty outside when you put it in your bag. And then the mask goes in your bag. And you remove those gloves and wash your hands. And that is your first time going in and out of a patient room.